Hey, I'm Colin Martin. It's time for another edition of Hump Day Highlight. We are excited to have Steve Porter, CEO of Piedmont Fayette Hospital, right here in Fayetteville, Georgia. Steve, welcome to Hump Day Highlight at the Fayette Chamber.
Hey, Colin. Thank you very much for having me.
My pleasure. So, as I'm recording this, it is Tuesday, September 1st. It's a little after 11:30. The question everybody wants to know is, how is everything at the hospital today?
Today, things are pretty good. It's been a busy 6 months for us dealing with all the COVID issue within the community and within the state and the country. But today we're doing well. We have about 30 patients that we're treating for COVID, but that's down from the upper 90s a few weeks ago. So we're seeing some good decline in the community and in the facility. Our team is doing an incredible job. I can't be prouder of the work that the physicians, staff, nursing, EVS, facilities, food services are doing to support this patient care need at this time. And I can't thank the community enough as well for the great support they've provided to us. It was well received and much needed for the staff and others to have that support. It really meant a lot to them.
What so right now you say you've got 30, which is I know a positive number, still too many, from a community standpoint. Is it possible for you to tell us how many of those folks are on the ventilator? Because originally that was the original worry, was the ventilators availability. I mean, you've got plenty available, I'm guessing, right now.
Yeah, we have all the support that we need from ventilators and supplies and what we call personal protective equipment and such. Fewer numbers today are on respirators or ventilators than what we call the first wave, because the treatment protocol has changed as we've learned more about the disease and the treatment process. I'd say of those 30, maybe less than a third are on ventilator. Most are just now treated with high flow oxygen versus requiring vent.
Well, I just want to say thank you to you and the staff and everybody at Piedmont Fayette Hospital for everything y'all have done. Certainly, early on, I want to say Piedmont Fayette was at one point one of the heaviest hit hospitals in the metro Atlanta area. And you guys have just been a great resource for this community and handled it well. And we greatly appreciate it.
I do appreciate that.
So let's talk a little bit about you. You're just over a year here in Fayette County. You've had quite the year already.
Yeah. They didn't tell me about this when I came here.
Yeah, that wasn't an interview question. How do you deal with COVID-19? So tell us, how'd you get here? Where'd you come from? Just what's your background before coming to Fayette County?
Yeah, well, I'm originally from Virginia. Spent 20 years with a large what we call integrated healthcare system called Centera Healthcare in Virginia, and really worked in all factors of the healthcare industry: insurance, physician practices, and hospitals. From there, I went to Charleston, South Carolina with Roper St. Francis. But during that time, I had a connection with Piedmont. I had former friends or peers that had worked with Piedmont in the past, and I had gotten to know Kevin, the CEO, and respected the system from afar. And while I was in Charleston, I had an opportunity to interview for a position out here, system I really wanted to be part of, and everything worked out. So made the decision a little over a year ago to come to Piedmont Fayette. And my family just joined me finally about 3 or 4 weeks ago. So now we feel more settled.
That's good. So tell us real quickly about your family. I know you have a wife and at least one child, if not more.
Yeah, my wife, Julie, she is a database architect specializing in Epic and other healthcare information systems. And then I have 2 children. My son, Jacob, is a rising junior at Clemson. I get in trouble when I say that once in a while in this market, but and my daughter is a freshman at UGA.
Okay, so you got one child that got it right and one child that didn't. Oh, well.
Exactly.
Well, good. We're glad to have you and finally getting you settled here. And so what has impressed you the most about Piedmont Fayette Hospital since you've been there?
There are many things I've been impressed. I mentioned one earlier. We have an incredible group of individuals caring for this community, from nursing to physicians, frontline staff in all areas, people who are really, really committed to the community and love this community. I've been impressed by the size and scope of this facility. You know, openly driving in the Fayette, when I came for my interview, I was like, how does a community this size support such a comprehensive facility, such a large facility? And so building on the work that has been done in the past has been very important, but the outcomes, the recognition that we receive for our clinical services is just so much to be impressed about the care that we're able to provide in this community and the quality and recognition that we get for it.
Yeah, well, y'all are a great partner to the community, not just in terms of the healthcare you deliver, but in so many different ways. And you're right, it's a great staff. I've gotten to know some of the top folks over there and some of the frontline folks. Really, we are blessed in Fayette County to have Piedmont Fayette to be here and have such a great team. So before we let you go, we always talk about what I call the 3 H's. A highlight, something you're hopeful about, and then all of a sudden I forgot what the third one is. A hero. Yeah, so let's start with your hero. Who's your hero?
You know, I'd have to say my parents. My father was a general practice physician in Richmond, and when I was younger, 12, 13 years old, I used to go with him on his house calls, and he would go to the most underserved areas of the Richmond market, and he would care for people regardless of their ability to pay. I remember at Christmas time, people bring a side of bacon or a ham hock or something, saying, Dr. Porter, when we couldn't pay, you still cared for our family. We just wanted to thank you some way. So that always made a great impression on me. And then my mother was a physical therapist. My parents divorced when I was 6, and there were 6 kids, and my mom was incredible at her commitment to family. She made sure that we were still engaged. We never missed a sports practice. We never missed an event. And I would see her leave work during the day, take care of us, and then going back to work at night. And so her commitment to us as a family, but also to her patients that she was caring for in the home, made an impression on me and was one of the reasons why I wanted to get into healthcare.
Yeah, so I was about to say, healthcare is the family business for y'all, it sounds like.
A little. The rest of the family, my brothers, they're 5 boys, 1 girl, and no one else got into healthcare.
Well, yeah, so I guess either you see that you can help people want to go toward it, you're like, yeah, that's not the lifestyle for me. And I'll tell you, you know this, my wife's in healthcare. Neither of our kids went into healthcare because they saw how hard their mom worked. So totally get it. Totally get it. What's a highlight from your career you're particularly proud of?
From a professional perspective, several years ago, I was given the opportunity to build my own, what we call greenfield hospital from the ground up, going out, finding the land, working with identifying the contractors, going through the CON process, and really just been given that opportunity to take something from nothing to an incredible hospital, both in terms of the building built, but the medical staff and team that I was able to build. At that point in my career, to be able to be given that opportunity is something that hospital CEOs aren't able to do every day. Very few people have been given the opportunity to build a brand new greenfield hospital. And so for me, that was an incredible recognition of what I feel I brought to the table from a talent perspective, and the responsibility and the scope of that project was something that I will always be thankful for the rest of my career.
That does sound pretty cool. You're right. That's not something that happens very often. That's very cool. And then finally, what are you hopeful about in the future?
Well, I think, given everything that we're going through, I'm hoping that we get this COVID behind us in the near term. I hope a vaccine is found that is effective for the broader population and has long-term effect. Our team, again, has been doing a great job, but they're tired. They would like to see this become, something in the rearview mirror. I do feel that it's going to change the way that we approach healthcare for the long term. But I'm really just hoping that we can get as much of this behind us as soon as we can, so we can get back to some level of normalcy, both from a healthcare perspective, but also from a community perspective.
Well, I wholeheartedly agree with you there. It's affected everybody in a different way. Steve, thank you for sharing your time today. We're glad you're in Fayette County, and we're just couldn't be more proud of the staff at Piedmont Fayette Hospital for handling this pandemic. Thanks for everything y'all have done, and I know I speak on behalf of our board of directors, our members, and really I'll even say I can speak on behalf of every person in Fayette County. Thank you for everything y'all have done. We greatly appreciate it.
Colin, I really do appreciate you setting this up, and I really, again, appreciate all the support that we received from the community as well.
Well, thank you. Great. Folks, that's it for this week's Hump Day Highlight. Be sure to tune in next week, but in the meantime, keep those healthcare workers on your thought and prayer list as we keep moving forward and dealing with this pandemic. Have a great week.